Hello and welcome to Fertile Minds. My name is Dr. Michael Flynn and I'm a fertility doctor with Queensland Fertility Group based on the Gold Coast. My topic in Fertile Minds is egg donation. What is egg donation? To me, egg donation is almost the most special gift anyone can give. Who are the types of women that ask for eggs and need eggs to help complete their family? Well, firstly, there's the women you don't think about. Everyone thinks you go and have normal cycles and normal eggs until menopause at age 50. But there is a subgroup of women who have premature menopause, really early that their ovaries stop working, and once the ovaries stop working, unfortunately, that means there's no more eggs. Secondly, in that same type of vein, there's women who've had to undergo chemotherapy and cancer type treatment. While it's really exciting that they've got over their cancer and therefore we can look towards the future and have a family, sometimes the chemotherapy can have such an effect on ovaries that there is minimal to no eggs left. And so egg donation is their only chance of having a family. There are other reasons though. When you think of some rare genetic disorders that the woman has from her family history and doesn't want to transfer those genetic disorders down to her children. There's also what we see at times, and is a really sad event, that couples have had repeated IVF cycles, and it's only then that you really understand that the reason they're not getting pregnant is egg quality. It's an inbuilt egg quality. It's something we can't test for. It's something we don't know about beforehand. But when you do IVF cycles and you see how the embryos go and you know it's the egg quality, you know it's not going to happen. And so women are asking for eggs. We want all men and women to have the opportunity of having a family. And so there are same-sex couples who the only way they can have a family is with donor eggs. So, can I be an egg donor? Well, there's no perfect answer to who the right egg donor is, and to a lot of couples undergoing fertility management, a lot of times you do see it's family members or someone who knows your situation and is able to put their hand up and say, yes, I'm here to help you. But there are altruistic donors as well. So within that, if I had a real opportunity of saying who's my perfect donor, it'd be nice for someone who's the right age. And that's a hard thing always to say, but certainly donors over 40 have significantly less success. Someone who has no significant medical history and that of genetic problems, it's possibly someone who's had their own children and so are not concerned or worried about their fertility into the future. But within all of that, if you want to be an egg donor, our next step always is come and talk to your fertility specialist, because it's such a special thing to do. It's an individual thing. What are the laws around egg donor? What's the processes? In Australia, there's little bits of different laws all over the place. There's a few commons, and that real common is that the parents whose birth, the mother, the woman who's birthing that child, is the legal parent of that child in Australia. And that's a common. The process of donor, however, is not an anonymous process, in that within Australia, donors are kept a registry. It's different in different states a little bit. The registry is either government held, or in Queensland at the present time, it's held by fertility groups. So that offspring always have access to have some type of details of their donor when they reached aged 18. But I guess the bottom line summary of all that is that in Australia, the woman who births the baby from a donor egg, or in fact donor sperm, are the legal parents of that baby. What's involved in donating eggs? Well, firstly, you'd see a fertility specialist, make sure that everything is ready to go, and we're really keen just to explain the process so an egg donor is making an informed decision. We often do a blood test called AMH to get a good idea of how many eggs you would have. But in the very end, obtaining eggs is just half an IVF cycle. It's exactly the same thing we do for every woman who comes along for their fertility management. When you think about it, in a normal natural cycle each month when you're trying to get pregnant at home, you're producing one egg. So in IVF we use the same hormones that make you produce one egg, but give it to you in a higher dose, with the aim each of this month to produce something like 10 eggs. We watch that cycle carefully by ultrasound scans, plus blood tests, and when the eggs are mature, we go and collect the eggs. On that day of egg retrieval, you often are a little bit tender and uncomfortable, but mostly then have a period approximately 2 weeks later. So it's a half an IVF cycle, and it is relatively involved, and that's why it's such a magnificent gift. So yes, you can be a known donor. It's still sort of the same process as an unknown donor, that we go through a counselling process beforehand, because there often are lots of little questions in the back of your mind that you're afraid to ask your best friend, or even your partner's afraid to ask your best friend. So it really is important, the counselling process, so all the little questions are answered and everything is out in the open before we go to donor. I hope I've given you a little bit of information about egg donation. Thank you very much for watching. Be sure to subscribe and keep up to date on all things fertility. Thank you.